Hi everyone, my name is Mitch Eisauer. I'm presenting to you my paper, Proposed Patient-Inclusive Methodology for Developing and Validating Patient Experience Surveys. I am a hospitalist instructor and clinical informaticist at Beth Israel Deaconess Medical Center. I've been working with the Division of Clinical Informatics on evaluating telehealth services using validated surveys with a focus on patient experience. Today we're going to be discussing the following. We will define patient experience and its significance, the pros and cons of surveys, go over validated surveys, review our research questions, go over our methods and results, discuss our results, review a patient-inclusive methodology to develop validated surveys for patient experience in telehealth, and then go over our conclusion. Patient experience encompasses the range of interactions that patients have with the healthcare system. To assess patient experience, one must find out from patients whether something that should happen in a healthcare setting, such as clear communication with the provider, actually happened and how often it happened. Patient experience impacts the quality of telehealth care, incentives, and reimbursements. Patient experience can be measured via surveys for quality improvement. You may ask, why use surveys? Survey strengths include confidentiality, independent assessment of clinicians and patients, pre-existing scales which allow for cross-study comparison, low cost relative to sample size, result generalizability, and the ability to validate surveys, thus ensuring accurate measurements of desired constructs. However, surveys have limitations, and inappropriately constructed surveys may exhibit a variety of biases and technical issues. Therefore, it is recommended that scientifically validated surveys be used to assess telehealth services. Validated surveys have been assessed and modified to ensure that survey measurements of constructs is accurate, dependable, and reliable. These surveys have been evaluated for face validity, construct validity, conversion and discriminant validity, and content validity. They've also been evaluated for the usefulness of their items, the reliability and internal consistency, and to ensure that they measure their intended constructs. In addition, they've evaluated to ensure that they consistently elicit the same results each time that they are asked within the same situation on repeated occasions. Therefore, given the importance of using validated surveys to evaluate patient experience, we ask the following questions. How well do validated patient experience surveys for telehealth cover patient experience domains? And how many validated patient experience surveys were evaluated specifically for use in telehealth? To do this, we identified patient experience subthemes via guidelines from the UK National Clinical Center, collected validated patient experience surveys from a recent systematic review, collected validated telehealth specific surveys from a different systematic review, constructed a matrix of patient experience subthemes and surveys and their survey questions. We then analyzed the matrix for patient experience subtheme coverage of each survey and cross-referenced validated patient experience surveys against known telehealth specific validated surveys. We extracted 5 themes and 114 subthemes from the UK National Clinical Center guidelines regarding patient experience. We collected 11 validated patient experience surveys from a recent systematic review. We also collected 12 telehealth specific surveys from a different systematic review. We constructed a 114 by 11 matrix of patient experience subthemes and survey questions. We analyzed the matrix for patient experience subtheme coverage of each survey. We also cross-referenced validated patient experience surveys against established telehealth specific validated surveys. This is a table of our results regarding subtheme completeness of patient experience surveys. You can see on the left validated patient experience surveys and their associated coverage of patient experience subthemes in descending order. We found that surveys covered up to 23 out of the 114 patient experience subthemes, or 20.2%. The most covered subtheme was psychosocial needs under the theme essential requirements of care, which was covered by 81.8% of surveys. This was followed by information treatment under the theme enabling patients to actively participate in their care with a focus on information, which is found in 72.7% of surveys. This was followed by pain, relationship with healthcare professional, explanation, and individualized approach, which was found in 63.6% of surveys. We also found that only one survey, the PEQ, was validated for patient experience and was telehealth specific. We ultimately found that current validated patient experience surveys cover only a fraction of all patient experience domains, and only one validated patient experience survey was evaluated specifically for telehealth services. Of course, we did note that our study had limitations. We only pulled subthemes from one source, so other subthemes may exist. In addition, we found that the subthemes may lack granularity or clarity to allow for specific categorization of survey questions. Moreover, focusing solely on subtheme completeness may not be the best strategy when producing a survey, especially considering other concerns like the completion rate of the surveys. Also, since we pulled surveys from only 2 systematic reviews, other validated surveys may exist. In addition, more research is required to determine which subthemes were most associated with patient experience. That said, having evaluated patient experience survey subtheme coverage, we recommend that patient experience surveys that are more subtheme complete be developed that are telehealth specific. Being recommended the development of new validated surveys for telehealth patient experience, I wanted to discuss developing validated surveys. This begins by identifying patient experience subthemes. Having already determined that the outcome of interest here is patient experience, we can move on to developing the survey questions. We start by recommending that patient experience subthemes be collected both from literature and from patients themselves. Patients can either be interviewed alone or as part of focus groups. Question development may then proceed. Previously extant questions may be used or modified, or novel questions can be developed. Questions should be relevant, unbiased, readable, responsive to change, clear, consistent, and sensitive to difficult topics. Alternating negative and positive phrasing should be performed to limit the halo effect. Recall questions should be avoided. Logically distinct responses, including non-response, should be available when answering questions. A scale for answering the questions should be chosen. Frequently, a 5-point Likert scale, scalers in the same direction is used. You may then move on to validating your survey. We recommend performing 2 pilot studies and a validation study if this is the route you choose to follow. Pilot study number 1 functions to assess face validity and usefulness of survey items, find which items are poorly performing so they can be removed or modified, and ensures that all relevant constructs are assessed. Pilot study number 2 reevaluates the above qualities and refines wording and layout of your survey. The final validation study should use a large representative sample of participants and establish construct, convergent, discriminant, and criterion validity. Should evaluate test, retest reliability, parallel forms reliability, and internal consistency reliability. It should also quantify the psychometric properties of your survey, such as Cronbach's alpha. When validating your survey, it is also important to consider survey administration and conduct. This includes your administration method, such as if your survey will be given over the phone or in person, your sampling frame, strategy, and sample size, strategies to improve response rates, such as incentives for survey completion, which can affect your survey population, disclosures to participants, which should be complete enough to give participants an understanding of what they are completing and assuage any concerns that they have, survey feasibility, data management procedures and analytic decisions, and privacy, such as how your data will be secured and anonymized. In conclusion, patient experience surveys cover only a fraction of all patient experience subthemes, and only one is validated for telehealth services specifically. It would therefore be valuable to develop validated surveys for telehealth, which better capture patient experience subthemes. In addition, validated surveys can be systematically developed for a variety of metrics as needed in a patient-inclusive fashion. Thank you.